Hi guys, welcome back to the channel. So we have started with osteosarcoma. We have seen the clinical features, the radiographic features, differential diagnosis, and we have seen the histopath and diagnostic workup. We have seen that biopsy is required and it should be taken from the lesion center. Then we have seen the chest radiograph, chest CT scan, and PET scan is included because to establish the mets and deposits. Then in histopath we have seen that there is a osteoid formation in a sarcomatous stoma. There is the stromal cells which can be osteoblastic, chondroblastic or fibroblastic, and they are mainly rounded, spindled, pleomorphic with atypia. Then we have seen two types of variants histologically. First is जिसमें heavily osteoid formation होता है which appears to be normal osteocytes, and the process is called normalization. Then we have seen about telangiectatic type जिसमें dilated vascular channels होते हैं और multinucleated giant cells होते हैं. Then we have seen periosteal osteosarcoma and parosteal osteosarcoma. Periosteal are mainly chondroblastic osteosarcoma, which is the expansion of soft tissue from the intact cortex, and parosteal osteosarcoma which develops on the surface of bone. So we have done till here and I hope everything is clear till here. Now we'll be starting with the treatment part today. We'll be continuing treatment part today, and tomorrow we'll be finishing osteosarcoma with the treatment plan. Okay, let's start. Treatment. After squamous cell carcinoma, osteosarcoma is one of the most common oral malignancy which are encountered by oral surgeon or dentist. So after squamous cell carcinoma, osteosarcoma is one of the most common oral malignancy. Okay, so mainly radiotherapy is not required in osteosarcoma, only chemotherapy is required mainly. Radiotherapy is not required in osteosarcoma like squamous cell carcinoma. In squamous cell carcinoma, radiotherapy as well as chemotherapy both are required. Okay. Osteosarcomas of jaws are ideally treated with initial chemotherapy of about 5 induction followed by surgery, which is followed by 2 or 3 additional induction doses of chemotherapy. तो पहले हम लोग 5 इंडक्शन देंगे कीमोथेरेपी का, उसके बाद सर्जरी होगी, फिर 2 और 3 एडिशनल इंडक्शन डोजेज होगा कीमोथेरेपी का. दिस इज़ आइडियल ट्रीटमेंट प्लान फॉर ऑस्टियोसार्कोमा. 5 induction, surgery, 2 or 3 doses of chemotherapy. Now, treatment involves selective chemotherapy protocols to sterilize micrometastatic deposit. Okay, first aim जो selective chemotherapy protocol है उसका first aim है कि to sterilize micrometastatic deposit that may be present in lung. Second is to test the tumor responsiveness to the chemotherapeutic agent by assessing the tumor shrinkage. तो पहला हो गया स्टेलाइज करना डिपॉजिट को. माइक्रोमेटास्टैटिक डिपॉजिट जो होते हैं जैसे लंग्स में चले गए उनको स्टेलाइज करना पहला गोल. सेकेंड गोल इज टू टेस्ट द ट्यूमर रिस्पॉन्सिवनेस टू द कीमोथेरेपिक एजेंट बाय असेसिंग ट्यूमर श्रिंकेज. कितना श्रिंकेज हुआ है उससे हम लोग असेस कर सकते हैं रिस्पॉन्सिवनेस ऑफ ट्यूमर chemotherapeutic drugs. And third is to decrease the tumor bulk, and third agenda is to decrease the tumor bulk. Now resection of entire tumor. तो सर्जरी में क्या करते हैं हम लोग, इंटायर ट्यूमर का रिसेक्शन करते हैं. द बोनी मार्जिन शुड बी एटलीस्ट 3 सेंटीमीटर फ्रॉम द क्लिनिकल रेडियोग्राफ एज. और जो बोनी मार्जिन होते हैं वो 3 सेंटीमीटर होना चाहिए फ्रॉम द क्लिनिकल एंड रेडियोग्राफिक एज. Now, a neck dissection is not required as not metastasized via lymphatics. तो osteosarcoma में neck dissection is not required. Instead, they readily metastasize via tumor emboli in the bloodstream and are most commonly filtered out in lungs. So they do not metastasize by lymphatics. Instead, they do by tumor emboli in the via tumor emboli in the bloodstream and are most commonly filtered out in lungs. तो lungs में जाके मिलते हैं. Okay, that's all for today. We'll be continuing the treatment plan in next class and we'll be ending osteosarcoma. Till then, like, share, subscribe and comment. Bye.